everyone, welcome back to our channel with another episode of Ask a Psychologist with Ms. Hana Haniffa. She is a psychologist and a lecturer in psychology. She has a master's and a bachelor's degree in psychology and psychotherapy. Today we are diving into an important topic that affects a significant amount of people around the world: attention deficit hyperactivity disorder, also known as ADHD. Whether you have ADHD, know someone who does, or just want to learn more, this video is for you. Can you explain what ADHD or attention deficit hyperactive disorder is to us?
ADHD is basically a neurodevelopmental disorder that typically appears in childhood, and it's a condition that could continue into adulthood as well. So, it actually affects the brain's ability to regulate attention, impulse control, and different activity levels at the same time. So, people with ADHD also have a lot of difficulty in focusing. They have trouble staying organized and also controlling their impulses.
We have discussed a few types of other conditions in our previous interviews. Are there any types in ADHD as well, and what are those types, Miss?
ADHD has three main types actually. So the first type is known as the predominantly inattentive presentation. So this is where children often have difficulty paying attention to details. They have trouble following instructions, and they also have a lot of trouble staying organized. The second condition is known as predominantly hyperactive impulsive presentation. So this is a condition where hyperactivity and impulsivity is present without a significant component for inattention.
Okay.
Whereas the third one is actually a combined presentation. There's inattentiveness and there's hyperactive impulsive symptoms also.
So what are the symptoms, and how could a parent or a teacher identify if a child has ADHD?
So before going into details, I actually have to explain or remind you about the fact that the symptoms could actually vary from person to person, and it could also change over time. So you cannot really expect the same symptoms to be present in the same person throughout the whole period of time, and also that every individual or every child with a potential for ADHD would display the same symptoms also. So for children, the symptoms often include trouble focusing on a particular task or playing with the same toy or item for the same period of time. They could also make careless mistakes in schoolwork, and do be mindful of the fact that every child could potentially make careless mistakes. So therefore, this is not a factor to actually consider as a direct symptom for for ADHD. But particularly repeated mistakes, or you see them happening frequently despite of multiple corrections, you see them making similar mistakes over and over again, that could then raise some concern. These children are also easily distracted. They would be fidgeting or squirming around with various toys or tools or whatever that's around them. They talk excessively, and they could also interrupt others. Now, when you look at children, these are quite common in children given their age category and given the regular habits or regular behaviors of a child. However, there are adults who grow up to have ADHD, so they would have certainly experienced ADHD as a child and eventually grown up and now as an adult may experience it. However, sometimes they may not have been diagnosed as a child. And it might have gone unrecognized, or it might have not been familiar, or something in their given time. But you would notice that that something isn't as okay as you would expect to experience through an adult. So you would notice a few, differences or a few symptoms in them. So one of the common things you would notice is very poor or very, difficult time managing time. So they do have trouble staying organized and staying on time with the tasks they have been given. They have difficulty starting and also completing a task. So getting started is often a reflection of poor time management and also poor organizational skills. So they will find it difficult to get started on the task because focusing on it is difficult, and getting themselves to get started is difficult. But at the same time, once they get started, they tend to, drag it. So completing that task, finishing it also could be a difficult thing. Impulsiveness, such as interrupting conversations or making hasty decisions, is a very common thing in adults. So you will notice that, like when they have to sit down for a meeting or when they have to sit down for a conversation, they're often inattentive and they're impulsive. They're very quick in, reacting, and they'll frequently interrupt a flow of a conversation. So when either you have a conversation with them and you're talking about one specific topic, they'll interrupt you with a different question. Or if you're speaking to somebody else and they're part of that meeting, they're likely to interrupt that as well. And they also have emotional difficulties, so like mood swings or low frustration tolerance and things like that. So they could find it very hard to manage their mood and things like that.
Right. So is there a specific cause for a person to get ADHD?
So there are certain myths about how ADHD is caused or how it happens. So let's kind of bust out a few of those and talk about the causes as well.
Sure.
So it's important to know that ADHD is not something that's, caused by poor parenting, or it's not something that's caused by too much of sugar and things like that, which often, tends to be a factor that is highlighted when children with parents with the children with ADHD are brought in for parent conferences and things like that. But it's important to understand that management of these things would certainly contribute to helping out with those. So watching their diet and making sure that they gain proper exercises and stuff like that would certainly help. So speaking of the causes, we really don't have an exact cause yet, or we don't understand the exact cause yet, but multiple researchers do suggest that genetic factors and differences in brain structure and differences in brain function do contribute to the cause of ADHD in children. There is also a myth that ADHD is an excuse for laziness or bad behavior or disruptive behavior in classrooms. But it's important to understand that as a teacher, as a parent, as a caregiver, you have to understand that ADHD is a real condition that requires proper diagnosis and proper treatment, and that children with ADHD could experience many or some of these symptoms in their lifetime throughout their childhood. So helping them throughout the process of this period and supporting them to grow is essential, and classifying them as naughty children or bad children is not the best way to go by for that.
Sure. Definitely. So how is ADHD diagnosed and treated?
Diagnosis usually involves a comprehensive evaluation by a healthcare professional. They do consider medical history and behavior questionnaires and things like that. Sometimes or some occasions they will also have psychological testing to assess whether the child has ADHD, and if so, in what state of it, and what conditions, what symptoms they particularly have as prominent. Treatment often includes a combination of medication, behavior therapy, and of course a lot of life changes. So one of the common things we do highlight with various conditions, not just with ADHD, that lifestyle changes and certain self-care mechanisms have to be incorporated into the day-to-day life of the individual, as some of these symptoms, some of these conditions could certainly be helped managed, or help improve through these changes that could be made in the lifestyle of the child. In addition, medications also help manage a lot of symptoms, and therapy can certainly help children learn coping strategies and organizational skills so that it helps them get through their day without being interrupted with the condition that they're experiencing.
Right. So like exercises.
Right. So regular exercises, healthy diet, good sleep hygiene. So particularly, making sure that they sleep on time and they wake up on time, and they're given ample time for naps and things like that, so they're rested. So it helps regulate emotions and mood. So therefore, their level of hyperactiveness, so their level of concentration is improved and not affected by tiredness or fatigueness as a result of this lack of sleep or improper sleep schedule. So, and as part of sleep hygiene, we also need to make sure that we keep devices away, as children nowadays tend to be a little too caught up with, having their phones with them when they get to sleep and things like that.
Yes, living with ADHD can be challenging, but with the right support and strategies, people with ADHD can thrive. It's all about finding what works best for you or your loved one. Remember, ADHD doesn't define you. It's just one part of who you are. If you or someone you know might have ADHD, don't hesitate to seek professional help. Early intervention can make a big difference. You can leave us a comment with your questions and doubts, and we will get back to you with a new video. Thanks for watching. If you found this video helpful, please give it a thumbs up and share it with others who might benefit. Don't forget to subscribe to our channel for more educational content.